I will introduce Marc Verhougstraete as our next speaker, and Marc will be speaking about One Water in One Health. Marc is a professor in community environment and policy in the Melanie Zuckerman College of Public Health.
Everyone, good morning. So I've made a career of health-related water microbiology. So today I'm going to talk quite a bit about One Health related to water in our environment. One Water is the premise that all water has value, and it's usually applied in our industry, our water sector, when they're trying to solve complex community water quantity issues. But the definition and the application, it's malleable. So today I'm going to take that definition and I'm going to spin it just a little bit and represent One Health or One Water and how it relates to the relationship in environmental health, animal health, and human health. It's a holistic approach that really puts us in the sector where everyone has a responsibility to address water issues, whether it's quality or quantity. It puts the responsibility for us to build resilient, responsible, and basically resilient communities that make sure our ecosystem and our communities can thrive. So the first system that I want to talk about is groundwater. Groundwater in Arizona, it is being abused. I will say that. So this is one of the only issues about quantity that I will talk about. Outside of our active managed areas, groundwater is being heavily pumped out, primarily from agriculture and industrial purposes. To the extent that we're actually seeing land subsidence, especially in the Southwest in Southern Arizona, we're seeing over the last 50 years, our land has shrank into the earth by more than 10 feet. Residential wells are running dry. The land is literally opening up with fissures, and this is primarily from agriculture over pumping. You don't have to be a water scientist to understand the health implications of a lack of water or when wells run dry for animals, the environment, and for humans. But I want to spend the majority of my time today talking about water quality, because as a health-related water microbiologist, I tend to focus on quality over quantity. The reason I want to focus on groundwater, and I can't overemphasize the importance of groundwater quality, is because 1/3 of Americans rely on private groundwater wells for their source of drinking water. Most of them will not have their wells routinely tested, and as such, we know that there's a lot of exposures to contaminants in the wells. About 20% of all wells that are tested will result in at least one contaminant being found. In Arizona, the contaminant of concern that we hear the most about is arsenic. Frank already presented a little bit on that. Dan mentioned it as well. Arsenic is found essentially in all drinking water systems throughout Arizona. When humans are exposed to arsenic in drinking water, on the acute level, we can expect abdominal cramps, nausea, vomiting, and diarrhea. But on the chronic exposure, it manifests itself as bladder and lung cancers, as well as a whole bunch of other health ailments. Unfortunately, in Arizona, the areas with the highest arsenic concentrations in their wells overlap with the communities that have the lowest socioeconomic status as well. And in some of these communities, we see elevated risk and elevated gastric cancer rates. Actually, we see rates that are 2 to 4 times higher than other communities that have lower arsenic concentrations in their drinking water. So my colleague, Robin Harris, did a study and found that 67% of the community that she tested also tested positive for H. pylori. H. pylori is a pathogen which infects the gastric system. When left untreated, those ulcers that it creates can turn to gastric cancers. So what we're trying to tease apart in our current studies is what is actually happening in our rural, underserved, and vulnerable communities who are drinking high concentrations of arsenic in their water. Is the arsenic causing elevated gastric cancer rates, or is it the H. pylori? So we've developed up a study, and we've finished this up last year using gastric organoids, human gastric organoids, and we've exposed them to various concentrations of arsenic and then infected them with H. pylori. And what we're finding is that as the concentration of arsenic increases, so does the infection of H. pylori, and so does the genetic markers for cancer. So there's an additive or multiplicative effect going on in these communities, leading to elevated gastric cancer rates. So that work continues, and we hope to have some additional studies going on this summer. Another really important water source that I've been heavily involved with is surface water. In Michigan, where I did all my graduate work in my early career, I quantified bacteria in surface waters, lakes, and rivers, and performed genetic testing to identify where the bacteria was coming from. And we found that the majority of pollution in the Great Lakes were actually coming from failing septic systems located along the rivers. In Brazil, we did a study, and Kristen Pargriba-Brown was a part of this study, where we used data from an epidemiological study conducted at a beach. We found a dose-response relationship between Enterococci, another fecal indicator bacteria, and gastrointestinal health. The majority of that disease was actually, or the majority of that bacteria was actually coming from untreated sewage in that region. Finally, we've worked at the Atlantic and Pacific Oceans up and down the east and west coast here, and we were looking at quantifying Vibrio species. Vibrio is a naturally occurring organism that is filtered and retained within oysters. When those oysters are harvested and consumed raw, there is a risk for vibrionosis, which we can expect, again, gastrointestinal illnesses among other health ailments. So we quantified the risk for multiple species and multiple species of Vibrio and multiple species of oysters around the world, and we're actually identifying that the risk is increasing in our northern latitudes. So this case study represents not only the interaction of a natural environmental organism to infect humans, but also the effect that climate change that we can expect to see additional increases in reaches of new pathogens in new areas. Being in Arizona, we have to talk about leafy greens. Leafy greens are a major commodity in Arizona's economy. Very famous is Yuma. That's because 90% of the leafy greens consumed in the United States during the winter months will be grown in the Yuma region. Most of that acreage is irrigated, and most of that acreage is irrigated with the Colorado River surface water. We know through multiple studies that there are a lot of pathogens, bacterial and viral, in the irrigation waters throughout Yuma. And luckily, there have not been a lot of outbreaks, leafy green outbreaks associated with these occurrences, except in 2018, when we had a E. coli 0157H7 outbreak associated with romaine lettuce grown in the Yuma region. Serotyping found the same strain of E. coli to be present in the feces of infected individuals, the romaine lettuce that they consumed, the soil in which the romaine lettuce was grown, and unfortunately, the concentrated animal feeding operation, which is located yards away from the field where the crops were grown. So this case study highlights the interconnectedness between the environment, humans, and animals, including the sensitivity of our food systems and water systems when competing commodities are grown really close together. When I talk about water and I relate this back to One Health, we'll start with animal health. So this is cyanobacteria. Cyanobacteria is also known as blue-green algae. It's a naturally occurring algae, if you will, that has the potential to generate a toxin. That toxin can be harmful to humans and animals. Let's see. So with blue-green algae, you may be thinking, I live in a desert, there's no water here. There is water here, as I presented already, and these blooms are actually occurring throughout the state. So they occur all the way from Lake Powell to the border, and they're occurring in frequency. Luckily, we have some really good scientists here on campus who are actually working through this and trying to solve the problem. I don't see Jean McLean, full professor in environmental science here, but she is doing some of this great work. Why we care about blue-green algae? When it is occurring, it often attracts animals. So dogs especially go to lakes, go to ponds, drink the water from that may be contaminated with this toxin. They either drink it, consume it, or expose their fur to it and then clean their fur, ingesting into their bodies. So what we see health ailments from this is vomiting, nausea, stomach cramps, And if a large enough toxin is ingested, we see muscle pain and liver disease as well. So this is an issue that we need to be concerned about. It is an emerging issue that we consider emerging throughout the world and not just here in Arizona. When we think of water, I've already presented how water impacts human health from a biological standpoint. Unfortunately, we know that there is a lot more going on in the world than just microorganisms. This is the case with the Gold King mine spill that occurred in 2015. This was a mine that was closed in the early 90s. There was concerns that there was water being built up in the mine itself. EPA contractors were on site doing some routine maintenance where they dug too low, releasing 3 million gallons of acid mine wash into the Animas River. This acid wash contained arsenic, lead, cadmium, and a whole bunch of other toxic elements. It made its way through 4 different states and multiple communities, including the Navajo Nation. This, while there were physical health implications associated with exposure to the acid mine wash for humans and animals, I really want to focus on the mental health aspects of this because it was devastating to the communities. For the 1 week where the water was visibly gold, farmers and everyone else who relied on that water system were told not to use it. After that week, when the water color returned to pre-spill conditions, people still don't want to use the water. Their livelihoods were taken away, right? And rightfully so, they should have been concerned. There was a lot of unknowns associated with what was in the water and where that contamination actually ended up, which turns out it's pretty insoluble and it was sinking to the bottom of the river, but we didn't know it at the time. So this really highlights the importance of the environment, and when we're harvesting our natural resources for all of our electronics that we all use, what do we do with the mine waste? It's got a human health implication to it, and we need to make sure that we're ready to address this because Arizona is full of 24,000 abandoned mines. So there's 24,000 potential opportunities for this to affect our limited water sources. And I will end on a clean, happy, green note. This is the Santa Cruz River. Santa Cruz River used to flow through Tucson year-round. For thousands of years. It provided fresh water for irrigation, for drinking, and an abundant source of fish for food. This ended around 1900 when the population of Tucson exceeded 10,000 people. At that time, the perennial flow ceased, and 40 years later, the last fish in the Santa Cruz River died out. So for the last 70 years, the water in the Santa Cruz River had only flowed when there was heavy monsoons. But thanks to the discharge of nearly 3 million gallons each day of highly treated wastewater effluent, 1 mile stretch of this river now flows year round. As soon as that water touched the environment responded. We have fish, butterflies, insects, birds, plants, everything is now returning to this one stretch, and it's fantastic. How am I doing on time? Yeah, all right. So I will end with the note that we call this wastewater. We often call sewage wastewater, and we need to get away from using that word because one health, one water, everything has value. So we call it wastewater, but the wastewater actually has value. Waste indicates unusable or invaluable or unvalued resources. But we know wastewater has value. In this case, wastewater or used water has value and it can save a river. The research that Gene McLean is doing has found the nutrients in this water can prevent the next harmful algae bloom from occurring. Even though the water stuck in a mine that's contaminated with toxic elements has value. Arsenic is used for agriculture chemicals. Arsenic is used for glass making and for the semiconductor industry. So there should be no wastewater. Every water has value, and that is one water. And not only does it have value to the economy, it has value to animals, humans, and environment. Did I say that? Yeah, okay. All right, thank you. I have time for questions. Yeah.
Have you seen patterns of this before and it ebbing and flowing, or kind of what's the history with that?
It's a great question. No, this is not a normal trend. We are seeing an ever increasing occurrence of blue-green algae or cyanobacteria blooms, largely because of the increased temperatures that we're experiencing, plus growth in human population. With all that growth, we have an increase in nutrients being discharged to the environment, fueling the growth of algae. Yeah.
How is this translating to policies that offer mitigating effects on some of this? In particular, you're talking about coastal areas. There's all this, people want to have a house with a view of the water and industry, et cetera. And yet we've got climate change where the tides are going to be rising. You've also got people want to put desalination plants in those areas, all of these other things that translate to building codes, et cetera, et cetera, et cetera. How do you translate those things over?
That's a really complex question that I don't know if I'm the best person to answer that. It's you're getting at resiliency though, the resiliency of our community and the sustainability of our growth to make sure that we have access to adequate water, right? Those policies are slow to come. We know policies lag by decades from the need to when they're actually enacted. So we see a lot of the action occurring at the local and state levels. From a oyster standpoint, the work is now being done at a regional level like Southern California or parts of Washington, where they're actually putting in place additional monitoring efforts based off of when we know the risk is going to be highest for a Vibrio outbreak to occur in the environment, which could then translate to food safety issues. So it's not the best answer, but I think you and I could talk afterwards and we can talk a little more resiliency. Question over here.
So you mentioned the socioeconomic disparity in microtoxin and microcyst and things like that in their exposures. I would like to get your opinion on sort of the two sides of that. So there's the exposure side, but then there's also, so the center did some work showing that there's a biological mechanism that in people of lower socioeconomic standing, they have a higher propensity for diseases, obesity-related diseases, that alter the disposition and the ability to eliminate those microcystin toxicants, and so that they are there's a biological mechanism as well as a socioeconomic exposure mechanism that can explain why they have increased disease burden. What's your take on both sides of that exposure issue?
Yeah, so you come from the toxicology standpoint, which that is not my expertise in. I am actually more of an exposure assessment person. So when I think of the exposures that we're coming in contact with in drinking water and surface waters, I think of how we can prevent that exposure in the first place, as opposed to reacting to the outcomes that it may elicit. So in this case, we've got a number of studies going on right now that are looking at point of use devices that can take out contaminants, whether it's biological or chemical. And so we're doing a national survey right now to try to address that. Where are most vulnerable communities who need such an intervention in their drinking water systems? Why or why not is that occurring? And what barriers are in place that we can overcome at a national level? So we are now calling primacy agencies across the country and local public water supplies to better understand the policies that are in place that we can change to make sure that the communities who are both biologically and societally driven to exposures and adverse health outcomes, how we can actually modify that and improve their lives. Paul?
People with private drinking wells don't typically get it tested, and I've lived most of my life on private drinking wells, and it's true. But I'm curious about public policy, because you move in, you buy a house, and your well is certified, but I don't think it's certified as to any of the contaminants you're talking about. But it gives you a good feeling that you're safe. And then you put in an RO system, and you really feel good. And you try to get it tested, and the county says, "No, we don't do that. You can talk to a private lab," and a private lab is maybe in Phoenix and costs a couple $100. So it's very difficult for people to get tested and really know whether they have a problem or not. So I'm just curious, is there any public policy work being done to try to make it easier for homeowners to know if they have a problem?
From a policy standpoint, the drinking water is really contentious. We had a bill in our state Congress that was very close to being passed until there was some outside lobbyists that got involved, and that bill ended. And that would have put in some place more water quantity protection than water quality. We've worked in some really underserved communities, and we put into place what Frank was talking about, some community-based participatory research, which gave the communities the tools necessary to understand, to test their water, to understand the results, instead of having to send out a sample, get results back a month later at the charge of hundreds of dollars. We gave them the resources that they can test that instantly and get results within a day, communicate those results back to their community without going into debt, basically.